Hello again. So this video is going to be very specific for C-section scar mobilization. So there's two things I want to go over. It's C-section scar mobilization and desensitization. So desensitization means I have numbness or pain right over the incision. And so you can start with a few items, but I'm going to give you just a list of items that you can start with. A cotton ball, a Kleenex is what we're going to demonstrate with today. And then something a little bit more rougher, so like a towel would be great. Something that has a little bit more um, dexterity, or it's going to be a little bit rougher on your skin, not feel as great. And what you want to do is you want to provide stimulus to the area that's numb or painful. That's a non-painful stimulus, so the cotton ball or the Kleenex. And in theory, the more often that you're doing it, the better that the sensation will get to the area. So it's similar to if you were to wear an itchy sweater. The longer you wear the itchy sweater, the less itchy it becomes. So if it's a painful area, that's what you want to use, is to start small and work your way up to something rougher. I would say 1 minute every day is fine to start with. And then you would want to add different things like the different textures of the items, like the towel, as you go through the process. So 1 minute of using this Kleenex or a cotton ball would be beneficial. So I'm going to demonstrate how to do that. So we have my C-section scar. And what you want to do is take the cotton ball, and the C-section scar is healed. There's no more staples. There's no more stitches or glue. And I'm taking this and I'm just rubbing it all around. 1 minute, rubbing back and forth, rubbing side to side. You start with something soft like a cotton ball, Kleenex, and then you move to something a little bit more rough. So the next is a C-section scar mobilization. For the scar mobilization, you can actually start pretty early on, so even within the first week or two, but you want to avoid the actual C-section scar itself until all the stitches, staples, and the glue and the steri strips have come off. So 1 to 2 weeks in, you want to get really close to it and then back off. So you want to push a little of the skin down and then back up. Skin moving. Nothing should be painful. Okay? Once everything has fallen off, you can get directly on the scar itself. You should be able to move the scar up and down. And you should be able to make circles all the way around the scar. And you actually should be able to lift the scar up. If your scar is indented in, it's called an invagination of the scar. That means there's some adhering underneath. And that would mean to get a little bit more aggressive, which we can talk about in person or virtually. But also you want to just work on this tissue. Once all the internal and external stitches have gone away, you want to be able to mobilize that scar and move it up and down. If that's still invaginated, there's stuff like cupping, dry needling, and a physical therapist that's trained in visceral mobilizations. There could be some scarring deep inside there, so you definitely want to get that looked at, and you want to let us know if you have any issues. If you have any questions, please comment below.